Pearson NCLEX RN practice questions. Question 1. Set 1. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? Normal function. An air leak. The lung has expanded. The tube is occluded. Continuous bubbling in the water seal chamber indicates a leak in the system. Question 2. Set 2. Which breath sound is commonly heard in a patient with an acute asthma attack? Crackles, wheezing, rhonchi, pleural friction rub. Wheezing is caused by air passing through narrowed airways. Question 3. Set 3. What is the diet recommended for a patient with diverticulitis in the acute phase? High fiber, NPO or clear liquids, high fat, low protein. During acute diverticulitis, bowel rest, NPO or clear liquids, is necessary to allow inflammation to subside. Question 4. Set 4. A child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 5. Set 5. Which EKG change is most indicative of a myocardial infarction? PR interval of 0.16 seconds, ST segment elevation, T wave inversion, presence of AU wave. ST segment elevation indicates acute myocardial injury. Question 6. Set 6. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 7. Set 7. Standard precautions apply to which of the following? Only patients with known infections. All patients regardless of diagnosis. Only patients in ICU. Only surgical patients. Standard precautions are used for all patients to prevent cross-contamination. Question 8. Set 8. A pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 9. Set 9. HbA1c levels reflect glucose control over what period? 24 hours, 1 week, 3 months, 1 year. HbA1c measures the percentage of glycated hemoglobin over the 120-day lifespan of red blood cells. Question 10. Set 10. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 11. Set 11. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 12. Set 12. Which electrolyte imbalance is associated with Trousseau's sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klosteck's signs indicate hypocalcemia. Question 13. Set 13. What does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 14. Set 14. Which lab value is elevated in acute pancreatitis? Serum amylase, BUN, hemoglobin, potassium. Serum amylase and lipase are significantly elevated in acute pancreatitis. Question 15. Set 15. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 16. Set 16. What is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, Move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 17. Set 17. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 18. Set 18. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 19. Set 19. What are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness, polyuria, polydipsia, polyphagia, poverty, pollution, population, pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 20. Set 20. What is the significance of the TNM staging system? To determine the cause of cancer, to classify the extent and spread of the tumor, to measure the effectiveness of chemotherapy, to identify genetic markers. TNM stands for tumor size, node involvement, and metastasis.